Hi there, I'm Colin Leslie, Editor-in-Chief of the Medical Post, and I'm here talking with Dr. Virginia Walley. She's the new President of the Ontario Medical Association. Welcome.
Thank you very much.
So let's sort of jump into what's happening right now. I gather we're at a bit of a standoff in some ways, that the Ontario Medical Association doesn't want to return to negotiations without some kind of binding arbitration, and Eric Hoskins is saying, well, we're willing to talk about that as an aspect, but we don't want that to be the only thing. Is that sort of where we are right now?
I think that's fair. I guess maybe I'd just step back a bit and just remind viewers that where we've come from. It's been 2 years since Ontario's physicians had an agreement with the ministry, and in that period of time, the ministry's imposed a series of unilateral cuts. Just over this last year, they amount to 7% of medical services that we believe patients need and deserve. Mm-hmm. We very much want to return to a cooperative and collaborative relationship with the government, but we need to do that in a process that's fair and reasonable, a process that has some form of binding dispute resolution, some perhaps binding arbitration. We believe that's the only way to truly guard the interests of Ontario's patients.
Mm-hmm. Well, just to play devil's advocate a bit, but why not return to negotiations and then keep the charter challenge going? The OMA, of course, is looking at whether binding arbitration should be mandated by the court system after the Supreme Court rulings last year. Then you might get something better than what's happening right now, and then not give up that charter challenge in case one doesn't. Why not try something like that?
Well, it's true. We've launched a charter challenge. We believe what the government has done and the way that they've treated Ontario's physicians is unconstitutional. We believe that there is quite a bit of case law that supports that. So, yes, we've launched the charter challenge, but that's a process that takes many years, and it's not a good use of anybody's time and energy. If we can sort out something earlier than that, then that would certainly be the best. What we maintain is that a requirement to getting back to the table for negotiations is having binding arbitration or a similar binding dispute resolution mechanism, because otherwise we'll just be in the same place that we were a couple of years ago, where if somebody didn't like the outcome, they stepped away, took the choice and went home. And that's not the best for patients. It's not the best for the system. Over the last 2 years, we haven't had a meaningful opportunity to speak with the government about our interest in improving the system. And that's just a crazy waste of resources. It's a crazy waste of the motivation of Ontario's physicians to improve the system. The pace of change these days, the innovation that's occurring in jurisdictions in the States, that's occurring in Europe and so forth, we're so far behind the time, and to not have a process where we can return to negotiations, return and agree on a process that will help Ontario sort its way through the need for redesign. It's just very wasteful. Yeah.
But when we talk about the pace of change, we've certainly heard more about what's called relativity, this sort of difference between how much ophthalmologists and some of the higher end specialties earn, and how much psychiatrists and pediatricians and family doctors to some extent earn. And of course the OMA has worked on this in the past. I mean, you've got CANDI and the RBRVS.
Yeah.
But do you think there's going to be more progress in the future on these issues?
I certainly hope so, because we want the work of all physicians, whatever stripe, to be appropriately valued. We understand that there may be some services that are overvalued at this point in time, but there are some services that are undervalued too. But unless we get back to negotiating with the government, we're not going to have the opportunity to redress those inequalities and to do any work with respect to this. Sometimes people think that that's under the control of the profession. Of course it isn't. This is an agreement. A redress of any inequities in the system is something that requires the participation and the agreement of both parties, the government and the Ontario Medical Association. So we need to get back to the table before anything meaningful can be done on that.
Yeah. And I noticed in the new issue of the Ontario Medical Review, which I got, they had the membership survey. And I think that something like 36% said they'd likely renew their membership if it wasn't mandatory. And really, you can see in the polling, it's about concern about negotiations.
Yep.
So how do you guys as an organization address that, or is it so dependent on this negotiations issue that it's hard to fix that until that issue gets resolved?
Well, certainly a huge issue for our members. They're frustrated, in many cases angry, in many cases distressed. People are worried about, whether they're able to continue to practice. Ontario are young graduates. There are graduates coming out of the training programs right now. They're wondering if they should stay in Ontario. It's not surprising to us that people are disenchanted with the situation. But we continue to do lots of other work on members' behalf, on the system's behalf. We have a big health policy program, health promotion program. We have a long history of working to try and improve the healthcare system, and historically anyway, doing that in concert with the government. And that's the kind of work that we want to return to.
Yeah. And of course, it's a big amount of allocation out of your time to be president of the Ontario Medical Association for a year. So, what sort of motivated you to take this on?
Well, it's interesting. I had an opportunity to reflect this past weekend because, as you referred to earlier, I had the honor and privilege of becoming the Ontario Medical Association's president this last weekend, and part of that involves an inaugural installation speech to council. So I was reflecting on exactly that question, and I told council on Sunday morning that I think a lot of it has to do when my father died.
Okay.
I was 10 at the time, and he was the lead in a play that the amateur theater group in Deep River was doing, and my mother and my sister and I were sitting in the front row, and he collapsed and he died of an MI.
Oh my!
As I was watching him, and I genuinely think that's when I first became interested in medicine, because that of course didn't make sense.
Yeah.
And why would that happen? My father was only 40. And I think my interest in trying to improve the system grew from that, and everything I've done since then is really been built on that.
That passion that comes from
Absolutely.
that. Absolutely. Yeah. And do you have? I mean, obviously, in a situation like we are, negotiation takes up a lot of the membership's mind. But are there other issues that you'd like to work on this year?
I mean, as I say, the OMAs work in health policy, health promotion. Some of the work we're doing recently on improving care for our aging population, which is an incredible challenge for everybody who has anything to do with healthcare, and for that matter, society more broadly. So we're doing a lot of work on that.
Yeah.
We're also we also want to work to engage our younger members. They obviously have different needs, different communication requirements, social media, so retooling around that. And then another personal passion of mine is encouraging more women leaders in healthcare.
I think you're only like the 6th or 7th OMA women.
Only the 5th.
5th. There we go. In 130 years or so.
135 years. I again, if I may, from my reflections at our meeting on the weekend, I think I'm the 9th president from Peterborough and the 10th pathologist to be the president, but only the 5th woman.
It's astonishing, isn't it?
There's something that needs to be done there, and so encouraging women leaders to take a bigger role will be a personal passion of mine.
Wonderful. Well, thanks so much for coming in, and thanks for your time. Cheers.
Thank you.
Thanks. Cheers.